Welcome to another hot episode of Tea with Lillian, where we are so obsessed with building. Today we have an amazing guest, Dr. Tania Caster. Woo! Welcome! I am
Thank
so
you.
excited to have you here. I cannot wait to talk about mental health. So we're gonna be sipping some tea. How's your tea?
Delicious.
This is green tea. You like green
Yes,
tea?
I love it.
I know that you have a lot to talk about when it comes to mental health.
And do.
So that's the reason why I could not wait for you to be our guest because we feel like the community needs that.
Yes, absolutely. So I'm going to also reintroduce myself too, just because I like to add my credentials just
Yes.
for everybody's knowledge. So my name is Dr. Tania Caster. I'm a board certified psychiatric nurse practitioner with a doctorate's degree, hence the Dr. Tanya. I've been in the medical field for about 15 years, and I've been practicing mental health and psychiatry since 2019. Um, I own an integrative mental health practice in Hollandale, Florida. I provide in person and telehealth services. So, mental health is something that is near and dear to me. It's a passion of mine. Whenever I hear the term mental health, I mean, I'm like a baby in a candy store because I'm so excited, especially for our community, just educating people and
Mm-hmm.
enlightening people on the struggles that we have and just how they can overcome them. So I'm
Mm-hmm.
excited to be here, Lily. Thank you for inviting me.
You're so welcome. You're so welcome. So, how important you think that mental health is in the beauty industry?
Um, when I think about the beauty industry, for me, I
Mm-hmm.
feel like most beauticians or people in the beauty industry as a whole
Mm-hmm.
are, um, let me see, what can I say, like unofficial therapists,
Mm-hmm.
right? Because for individuals who are in the in the beauty industry, a lot of the times people come to you and they build like a sense of trust.
Mm-hmm.
They build a relationship with you, and over time, you start to know about their families.
Mm-hmm.
They start to tell you about their problems,
Mm-hmm.
and you take on so much. So you find yourself in a position where you are like a therapist in a sense, right? Where you're giving advice, where you're trying to like encourage people, where you're trying to give them hope. And a lot of the times, you don't have it yourself. You're going through your own struggles, but you're in a position where you have no choice but to provide some type of hope,
Mm-hmm.
try to uplift people as much as possible because the world is already or can be a depressing place,
Yeah.
right? So when these people come to you, a lot of the times as people who are in the beauty industry, when women or men, when they come to you, this is like a break
Mm-hmm.
from their reality.
Mm-hmm.
So I think people who are in industries where you're constantly serving people and
Yeah.
you're coming across people with different energies, different
Mm-hmm.
backgrounds, different attitudes, that can be a lot on
Could be
you.
draining.
That could be draining
Mm-hmm.
and just mentally exhausting,
Yes,
you know?
I agree. I totally agree. Like, I had some clients that when they going through stuff, like literally by the time I leave the shop and I go home, like I have to,
Decompress.
yes, and it's a lot of that.
Yeah,
Yeah, so you're right about that.
I can imagine. And for me, it's so as a mental health provider, oftentimes people say, well, oh my gosh, I'm sure by the time you're done, you need therapy yourself. But what people don't realize is I oftentimes, don't get me wrong, I'm human.
Mm-hmm.
There are stories that I hear that just, it kind of throws me off.
Mm-hmm.
I need to decompress. I need
Mm-hmm.
to call somebody else to, maybe just kind of release
Mm-hmm.
because it's stressful depending on the stories that I hear.
Mm-hmm.
But for the most time, I'm able to disconnect myself
Mm-hmm.
because I understand my role,
Mm-hmm.
that I'm here to support you
Mm-hmm.
and to encourage and to educate you about and to give you resources
Mm-hmm.
that can help you come out of what you're in. But for someone who's not trained and who
Mm-hmm.
haven't gone through the education and all that, I imagine if you're struggling yourself, right,
Mm-hmm.
and you're having to pour into people, there's going to be a point in time where you're pointing from an empty place.
Yeah. Yeah.
And
I agree.
that's what I feel like for a lot of, because I'm I have friends,
Mm-hmm.
Of course, I'm constantly like, interacting with people in the beauty industry. I love beauty.
Mm-hmm.
So, and I hear their cries.
Mm-hmm.
And a lot of the times they internalize it. They keep it inside. They don't have anybody to like release to after everybody dumps and dumps on them all day. It's like you go home, you're exhausted. You don't even have the energy now
Mm-mm.
to even like open up to even your own family about the struggles that you face.
Oh my God, you talking like it's hitting home.
Yeah,
That's
I'm,
true.
I'm sure you can relate
Yeah, I
being
can
in the industry as
definitely
long as
relate.
you've been in it.
So, have you ever had any beauticians or anyone in the beauty industry that came to you and that
Oh,
seeked help?
for sure. Um, the thing is that what I'm excited about when we talk about mental health is that people are more enlightened, people are more comfortable
Mm-hmm.
with just the idea of seeking help.
Mm-hmm.
It's no longer taboo.
Mm-hmm.
People are not afraid now to say, "Hey, I, suffer from anxiety, or I've gone through depression, or I am depressed."
Mm-hmm.
People are more open and more vocal about it now because there are so many people just talking about it. Social media
Mm-hmm.
has shined so much light on it. I feel
Mm-hmm.
like, and a lot of influencers have now been coming out with their struggles, that I think it makes the average individual just more comfortable to say, "Hey, if this multimillionaire
Mm-hmm.
or this person who's in the limelight, if they struggled,
Mm-hmm.
then I mean, of course I'm gonna struggle
Mm-hmm.
living an average life." And when you have people with influence that's coming out with it, I think it
Yeah.
kind of helped like shine light.
Mm-hmm.
So I'm excited about that, and about like people reaching out to me more now saying,
Mm-hmm.
"Hey, I need to talk to you. Like, what insurance do you take, or how much do you charge? Because I need a session. I want a session." So people are more open to it now.
Okay. I mean, I'm not sure if you are able to, but I'm gonna ask if you are able to.
Hmm.
Like, can you share with us, like, probably an experience you had with someone that probably was like that took you by surprise, like how they came at you with
Um, gosh,
their mental issues?
I've had so much, so many. One thing that I mean, because I can talk about stories.
Mm-hmm.
I'm not I'm not going to expose a name, an
Mm-hmm.
age, or anything. So these are just stories,
Mm-hmm.
right? Um, One thing that I find that is pretty common, especially with women. So I'm going to talk about the women.
Mm-hmm.
Because now you find more and more women are in a place of being the breadwinner in the
Mm-hmm.
house, so to speak, right?
Mm-hmm.
They're the ones supporting the family
Mm-hmm.
financially,
Mm-hmm.
even with a husband or with a significant other.
Mm-hmm.
Um, so the problems that I'm finding a lot in that group is um, not being able to get that support that they need
Mm-hmm.
within the family.
Mm-hmm.
So not having someone who's emotionally available for them.
Mm-hmm.
Um, them feeling that they have to step up
Mm-hmm.
and play both roles, man and woman, even if they have a male
Mm-hmm.
that's present in the home.
Mm-hmm.
Now, this is not like male bashing or anything like that, but it seems that that alone, in addition to unresolved childhood issues, unresolved issues from the past relationships, or mommy and daddy issues, you tie all those things together,
Mm-hmm.
it's just like an explosion. And a lot of the times people don't identify that they're dealing with things mentally until it's like too late, in a
Mm-hmm.
sense. Usually it's their families being torn apart. Usually it's in the middle of a divorce.
Mm-hmm.
Usually it's while their children are acting out and
Mm-hmm.
like, on drugs or like on the streets, is when they realize, like, wait a minute, hold on, like I've been absent.
Mm-hmm.
Like, where have I been? How did I miss a lot of these things?
Mm-hmm.
And it's because of a lot of unresolved issues that they bring in from relationship to relationship, or from situation to situation.
Mm-hmm.
So, there's so many different things that I've come across, but I have to say, like with women, especially in our community, that seems to be one of the biggest struggles that they face. I hear the story. It's kind of like I hear it so much that it's like, wait a minute, like is everyone living in the same house?
Mm-hmm.
Because it's just that consistent. Like it's
Yeah.
just like the same story over and over and over again. Where for me, I think it's a knowledge deficit
Mm-hmm.
in our community on both sides, on
Mm-hmm.
both for both men and women.
Mm-hmm.
A lot of the times we kind of like put things in a back burner so much
Mm-hmm.
that when we're faced with the adversity and when we're faced with those challenges, we don't know how to deal with it because nobody ever taught us how to deal with it. You know, growing up as a Black person, whether you were Black American, Black Caribbean, whatever your background, or if you're of African descent, let me say, for the most part, we were taught that you be strong, like you be courageous. Like, what are you crying about? Yeah. Do you know there's people in other countries that's suffering that can't eat? So what are you complaining about? So what do? We don't complain, we internalize things, right? Because when we complain, we're called naggers, we're called all these things. So what do? We internalize, we keep it and we keep it in, and one day, guess what happens? An explosion happens.
So they expect us to be strong.
Strong. And that's the thing. You know, for a long time, you know, in the Black community, you know, being independent was like a flex. Right? Being independent was a flex for a Black woman. It's like, I'm independent. Neo even came out with a song.
I was just thinking
Remember,
that.
right?
Yeah, and
Neo used to come, this independent.
Yeah.
We loved it,
Yeah.
right? But we didn't realize what we were doing was like demasculating our men.
We messed up big time.
We messed up, but we didn't know. You don't know what you don't know, like, you know, and or the term alpha female.
Yeah.
We took that and we ran with it. Like, it was a flex again, right? And what did we do? In a sense, we were indirectly telling our men, we don't need you.
We don't need you.
We don't want, like, what can you do for us?
And when
like,
they act like they don't need us, we get upset.
We get upset. But what happens is now, if you tell someone time and time again, I don't need you, I don't care, I can do this by myself. Yeah. What happens? A person becomes numb. Yeah. Right? And then there begins the break of the family dynamic. And we're seeing it more and more now that people just don't care. They're like, love doesn't exist. We don't care. I can have you. I can have them. It's just, things are just not what it used to be, because for so long, we operated in this, we normalized toxicity. That's what we did. We normalized dysfunction for so long that it has become part of a lot of people's DNA. You know, I experienced a lot of those things personally. It wasn't until I started to identify certain things about myself through clients, through my patients, actually. I was like, wait a minute, ooh, I experienced that. Ooh, yep, girl, that's you. Ooh, wow. I'm like, I can relate in my mind. Like, as I'm giving therapy or as I'm doing an evaluation, I'm like, wait a minute. Wow. Like, okay, like, you need to take that too. You need to take that advice as well. And, you know, I started to work on my emotional intelligence. I stopped responding to things the way I used to respond to it. Like, it wasn't me popping off anymore. It wasn't me quick to lash out anymore.
But it was challenging, though.
It was.
It's not easy.
It was.
Especially when you're used to being independent and a boss. Like, it's very challenging.
And I know a lot of women, such as yourself, can relate to that, because when you're in the beauty industry, this is a cash-driven industry where women and men are paying top dollar to look good, right? Especially now, right now, with social media and everything. I mean, back then it wasn't. I mean, people were paying top dollar back then, but now it's triple. It's not the same. So you being in that position of power, in that position of authority, right? And having to now humble yourself. That's not easy.
I'm still dealing with that now. Trying to humble yourself.
Trying to humble yourself. You know, trying to exercise humility. Yeah. That's not easy, because growing up with mothers who were so strong, right? A lot of women growing up with mothers who were really strong, who were really steadfast, who were like, listen, you can do this. You don't need this. You don't need a man. You got this. Trying to undo years and years and years and years of that isn't easy. It's just really not. And unfortunately, a lot of people don't give us grace. Yeah. They just don't. One of the most difficult things in the world is to be a Black woman. I'm sorry. It just really is. Yeah. The expectation of us is just so much. Everybody expects everything. You're almost expected to be a superhuman.
But it's okay. We still love
you know? And I wouldn't be anything else if I came. But it's just having that expectation sometimes can be difficult. You know, having the expectation that you have to be somewhat perfect at all times. That you're not allowed to make a mistake. You're not allowed to lash out. You're not allowed to be angry. You're not allowed to, you know, respond a certain way. You have to be this way. You have to be that way. You have to be poised all the time, and not being raised like that. It's difficult, and it's put like a lot of pressure. I see that a lot. Like when I talk to a lot of women, you find that trying to redevelop themselves is even more challenging than all the bigger issues that they faced previously, because now you're having to undo and unpack just all types of baggage. And a lot of the times for me with clients, I start from very little. From the first memory that you had that was bad, from the first disappointment, from the first experience with rejection, from the first experience with abandonment, from the first violation. That's where I start. And then we then work our way up to the adult that you are now. So,
but why is that men don't like counseling? Well, the men's I have come across, like they don't like counseling, especially the black men.
um, let's think about it. When you think about a black man, right? And you think about what black men have to face on a daily basis, the expectation of a black man is for them to be strong. Think about, let's think about a little boy, right? Anytime a little boy is brought up in a black household, for the most part, if they're not allowed to cry, they're not allowed to whine, they're not allowed to really show emotion, because they they're expected to be tough at all times. They're expected not to really show emotion. Usually when a little boy cries in a lot of black, like, be quiet. What are you crying for? Are you a girl? You're not a girl. So which in turn tells them that crying is for girls. Emotions are for girls. And now you expect this black little boy to grow up and be a man and to just all of a sudden just dig up emotion just from where? Where? Who taught them how to be in touch or in tune with their emotions?
They were taught to keep it in.
They were taught to keep it in.
Even the females too.
That's what I'm saying. Yeah. But even worse for a man though.
Yeah.
Because when a little girl cries, it's expected, right? It's come on, baby. You cater to that little girl, you embrace her, you hug her, you comfort her. Whereas with the little boy, a lot of the times they're not getting that same response. They may get that response from their mom, not the dad, or they may not get that response from the mom. It just depends on the mom's upbringing herself. So it's difficult because it's like, if I trust you, if I go to the stranger and I trust them to tell them that, I've been battling with my emotions, I'm depressed, or I've been contemplating suicide, or whatever it is, it's like, get a grip, you're a man. Because this is what they've been told their whole life. So the fear of somebody else telling them the same thing is there. So instead of them putting themselves in a position to be vulnerable, they try to figure out how to fix it themselves. And that's how you have the issues with drinking, smoking, or even those guys that kind of seek, just kind of like tap into being promiscuous. So they deal with multiple women to cover up those wounds, or to just kind of like as a stress relief. When in turn what they're doing is kind of like damaging themselves more. But in the moment they're not realizing it. And what I love though is that I do see the men coming around. And it's not just, believe it or not, it's not just in the black community, because I see people from all types of backgrounds. Asian, Hispanic, Caucasian, all different backgrounds. And believe it or not, men are always reluctant. Even when they have to be on medication, it's like, well, I mean, I don't need this. I've had men who were going through divorces, crying. I mean, crying, like, sorry, I don't mean to cry. I'm not a girl. And I'm like, you don't like cry. Let it out. Release. I don't see you as a girl. I see this all the time. This is not foreign to me. It's not uncommon. Your situation is not unique. Cry. If you have to let it out, let it out. And it's still uncomfortable for them, to just kind of like get in tune or be in touch or tap into that emotion. It's, so I encourage people, even with, when I see parents like just really being harsh towards their kids, like especially little boys, I'm like, no, just soften up, allow them to express themselves, embrace that, encourage it, because, that little boy is going to grow up to be somebody's husband. somebody's father, and you don't want them to, re-traumatize or traumatize their kids or their wives. You want to break that curse, from their childhood. Just because you experience it, you want to try to, your absolute best. Of course, you don't know what you don't know. Again, you may not realize that you're damaged and broken and bruised. Sometimes it may take somebody else to kind of call you out. Now, being called out is another thing. Like, can you take it? Are you accepting? Are you in a place where you're ready to change? Are you ready to look in the mirror and say, you know what, I need help. I'm broken. I'm in a messed up place in my life.
To know that there's a problem.
And it's hard for people to identify that within themselves. Because let's be honest, as human beings, what do we always want to be? Right.
Yeah, just like I remember when I was like maybe like 10 years back when I started doing hair, I got so busy. I was always working, and my kids, I was not there as much as I needed to. But me in my head, I'm like, I'm working, I'm building, I'm providing, so that's my way of showing that I love. And only because that's how I was brought up, that's how I was raised. So my daughter at times would tell me like I don't love her, and I'm like, what do you mean I don't love you? Like, I'm always providing, I'm always doing. But she really meant that I'm not there emotionally. That's a major problem in the Haitian community.
No, you're absolutely right. In the Haitian community, it's, oh, geez. Honestly, growing up Haitian is just a whole different, it's a different level of trauma within itself. Let's just be real. Um, when I look at a lot of the skits like on TikTok and on Instagram, it's funny, but it's sad. It's a it's funny, but it's truly sad because I realized I'm like, man, it's a cultural thing. Like a lot of people kind of like experience the very same thing, right? And it left a lot of us traumatized. And I say us because I'm of Haitian descent too. My parents, are Haitian. I was born and raised here in Miami. However, with the same, cultural practices, just the words, just, just everything in general. Um, of course, we don't know how to be in touch with our emotions, or we weren't taught because, listen, they worked, they provided you with a house, you were expected to just go to school, do your thing. If you went to church, go to church, and that is it. And if they had the time to maybe bring you to a park, if they had the time to maybe take you on a trip or something, it just all depends. It all depends, because I remember like some of the best times for me as a kid was going to Morningside Park and going to McDonald's, because going to McDonald's, like, that was huge.
So your parents was doing great then.
I mean, it didn't happen often, but when it did happen, it was like amazing. Just going to McDonald's, the 29-cent hamburgers or the 39-cent cheeseburgers. Just doing that was just, it was exciting. It was nice. And doing a few things. I never went on like major vacations as a kid. But the parks and like the theme parks and stuff like around like in Broward and stuff, it was fun. But just a change of scenery. Um, but um, but then again, when you're like back home, it's like, God forbid a teacher calls your parents. God forbid you act.
You can't go
Man,
to McDonald's no more.
listen, forget about McDonald's. I'm talking about the backlash that you're gonna get when you get home. It's like, oh my gosh, just like the words, just, I mean, hey, the stories that I've heard, and it's just, man. And I think about it, and I think about, us as adults, right? When I talk to people that, from childhood or even clients, honestly, who are of Haitian descent or Caribbean. Let me just say that. Caribbean as a whole, it's like, whoa, man, we need help. Like, seriously, there's like a lot of undoing that needs to be done. I was just having this discussion with my first lady, And I was saying, I have a lot of clients of mine who are in church 7 days a week, 7 on 7, no lie, who they are worshipers, they are men and women of God. Like they are in it, praying, fasting, doing it. But they still struggle with depression, anxiety, low self-confidence, all of those things. Because what happens is, one of the examples that I gave, I said, well, here it is. You've been told your whole life that you'll never amount to anything. You've been told your whole life that you're going to be just like your dad or just like your mom, right? You've been told your whole life you just like your daddy family, just like your mama family. Y'all just no good. Your whole life you've been told this from childhood all the way up to whatever age. And now as an adult, I make a sound decision to give my life to God. Now I'm in church. I'm around positivity. I'm doing it. I'm reading the word. I'm doing all this. Yeah, I want to have the faith, but the foundation that I have, I never really worked on it. Yeah, I believe that God is able and he could do all things. However, there's that little girl in me, there's that little boy in me that's still crying and yelling for help. That still wants to be told by mom or dad that you can amount to something. You are great. Like you will win. Like all those things. Yeah, I hear from the pastor. Yeah, I hear from the first lady. Yeah, I hear from my brother in Christ. Yeah, I hear from my sister in Christ. Yeah, I see it on TV. Yeah, I hear it on social media. But the person that matters to me the most never said it. It's just like, I've used that example. Some people are like, well, yeah, but our parents didn't have it. And I said, well, imagine this. Imagine everybody saying, your mom loves you. You gave an example about your daughter, right? And you thought providing was showing love. But did you physically say, baby, I love you, baby, this is for you. I'm working hard for you. I'm working hard to give you a better life. Did you ever say those words? Did you ever have that conversation?
Actually, years later, that's when I start developing the idea of, you know what, Lily, you need help. Because it was so hard for me to say the word I love you. And them growing up, they don't want that taught me to feel comfortable to say it. Because it was never said to me when I was a kid.
Yeah.
But I knew my parents loved me.
Correct.
I knew that 100%.
Correct.
So it was tough.
Yeah. Yeah. I know. I can relate. Personally and professionally, just even with so many different people, I hear it. It was a hard thing for me too. So I have an older son, and then when he was much younger, I could say I love you 50 million times. Like, I love you, kissy, 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 kissy. And then that kid grows up, you're working, you get caught up with life, they start acting out, and they start pissing you off. And, of course, that Haitian part of you taps in. Because that's what you know. That's how you were raised. So you tend to parent how your parents parented, right? So you expect, like, hey, I'm giving you shelter, I'm buying you nice clothes, I'm giving you games. Like, you should be grateful. Like, what else do you want from me? Time. Time. And, sometimes I look at it and I'm like, man, time is just something that I don't care what you provide for somebody physically. Material things cannot replace time. Knowing somebody loves you and someone saying they love you is two different things. Yeah, you knew your parents love you, but it probably would have made a world of difference if they would have actually held you and said, baby, I love you. So now it's a common practice that my son actually, like before we get off the phone, love you. So it's like a thing now. With my daughter, if she talks to me 10 times a day, she'll say, I love you 10 times a day. Yeah. She will not hang up the phone without, I love you. So it's just that constant reminder that you can change. It's just a matter of you identifying. It doesn't matter how old you are. As long as you're able to identify that, hey, I need to do better, it's never too late. I tell people that. I don't care if you're 50, 60, 70. If you identify that something needs to be fixed or something was broken, fix it.
It's just be the pride.
It is. Ego. Growing up Haitian, again, That's something that I have to say. Pride and ego is something that is killing the community. Big time. Big time. Pride and community. Um, one thing that is very common, I'm sure every Haitian person can relate with this one statement. Fogging nila figure, right? In English, they say, I mean, it doesn't make sense when you say it in English. You gotta have a nose on your face. Yeah. Duh, I know I have a nose on my face. But I don't know what that comes from. But once they say that, it's like, whoo, your ego just takes over and you like, I'm not gonna apologize because listen, what I look like, or I'm not gonna bow down because what I look like, I'm me. Your ego takes over. And a lot of the times, think about it. There's relationships that you were in that you possibly could have fixed, but your ego didn't allow you to. There's friendships that you were in that you could have fixed. Ego didn't allow you to. There's jobs that you were at that you didn't have to leave. Your ego wouldn't allow you. There's situations that you were in that you didn't have to be in. Your ego took over. So, being raised that way is just, that's just the culture. But can we continue on every single day saying, well, that's how I was raised. That's what it is. That's the culture. It's ignorance. That's what it is. Because once you, because right now there's no reason, honestly, to remain in a situation that you're in. There's too much information out there. Yeah. There's social media. There's Google. There's YouTube. There's so much. There's TikTok. There's so much out there that you can research on any issue that you're going to. That there's just too much information out there to just remain in your ignorance. I mean, don't get me wrong. There's some people that are comfortable living in it, and they'll make every excuse. Well, I'm not ready, and you have to give people time, and you have to give people grace. Okay, I believe in that. But how long are you going to constantly and consistently make that excuse? What, 10 years, 5 years, 20 years, 30 years? I mean, ultimately, it's up to you. But when you think about what's at stake, when you think about your children, when you think about your family, when you think about your future, then, your mindset starts to change a little different. It depends. When you put things into perspective, how important are those things to you? How important is the development of your children? How important is your future? How important are your business relationships? How important is it for you to just like break a generational curse? When you start to put all those different things in perspective, honestly, it kind of helps change the mindset. It kind of helps shift the mindset. So now it's like you're looking at things from a different lens. Now you start to check yourself more. A lot of the times, people oftentimes ask, are you ever upset? And I'm like, you have no idea. But for me, when I think about all the times that I've been upset, it has always put me in a place of setback. I've always been set back. Every time I've been upset, I've always been set back. Because anger really puts you in a place that's uncomfortable. Because what? You say things that you don't mean. You do things that you don't mean. Sure. You do things that you later regret. You do stuff that you may have to later apologize for, but they were said and they were done. You can't undo them. You can't reverse it. You can't take it back. And but when you start to develop yourself emotionally, when you start to identify issues that you struggle with, and become intentional about changing, about improving, then I'm telling you, just the quality of life that you live is just going to be so much better. And it's going to exude. People are going to notice it. When you walk in a room, people are going to feel that energy. They're going to feel that change. They're just going to feel, that positivity. It's just going to exude. You don't have to say a thing. When you shift and when you change for the better, it's something like you walk into a room and you're just like a shining light. And that's the thing that I try to encourage all of I'm not one of those providers that just push medication. Obviously, some people need medication. You just need it. Some people are not as strong as others. We have different strengths. We're individuals. We're all unique in our own special way. What's important is identifying your strengths. So I help people identify what are you good at? What are your strengths? What are your weaknesses? We work on that. Okay, so we're going to tap into that strength. And we're going to work on that. And we're going to tap into your weaknesses and identify what makes some of your weaknesses and how can we strengthen that. I do a lot of empowerment when I provide therapy. I do a lot of self-building because believe it or not, when you don't have self-confidence, when you don't believe in yourself, you kind of like just accept things. People, you allow people to walk over you. You allow people to do as they please. You put yourself in a position of being a doormat because, I mean, you don't have self worth. And a lot of the times, it's not because they don't want to have self worth. It's a lot of times they weren't taught that.
Yeah.
You know, I use the example all the times. I say, I was recently doing this interview, and I asked, there was about 5 people in the room, and I said, how many people were, as a child, was raised to look out for themselves? How many people were told, look out for yourself?
Mm-hmm.
Only one person out of the 5 said, me. How many people were told, love yourself? Like one person answered. Because think about it, when you think about even a Caribbean household, oftentimes you have grandparents in the house, you have younger siblings. If you're an older sibling, look, you're like a second mom or a second dad.
Mm-hmm.
You're responsible for everybody else, right?
Mm-hmm.
So you're responsible for everybody else plus yourself. You're oftentimes expected to put yourself last.
Mm-hmm.
So you grow up with that same mindset.
Mm-hmm.
That's where the people pleasing comes in. That's when, you start just accepting things, overextending yourself. And with all of those things, that's when depression, anxiety, all those different things kick in from all of those like issues. And all of that stems, again, childhood.
Mm-hmm.
So,
What do you say when somebody say they want to put themselves first? There's like a little pro and con with that, I feel.
okay.
Because sometimes you can be selfish while you are putting yourself first. And then at times, it's self care, if you get what I'm saying.
Of course.
So when somebody says something like that to you, like how would you find out, like, where is that coming from?
Oftentimes, when I do an evaluation again, I start off from childhood, how you were raised, everything.
Mm-hmm.
And from that story, that's how I identify. From you telling me about your life, right? That's how I identify it. For me, I always encourage people to be selfish at times. I encourage it. It's something that when people hear the word selfish, automatically they think negativity. They think there's like a negative connotation that's associated with the word selfish. Selfish is not always a bad thing, because sometimes it's necessary for you to be selfish. Because if you're not your best self, how can you be a good mom? If you're not your best self, how could you be a good wife? If you're not your best self, how could you be a good hairdresser? If you're not your best self, how could you be a good friend? How? How can you be a good person? You know what I'm saying? So sometimes you have to be selfish in order to build yourself and to pour into yourself. Because when you're constantly pouring, that cup eventually, I don't care if you pour enough to this tea, there's only so much that this teapot can hold. Yeah. There's only so much. Even if you want to pour from a place of overflow, not from a place of lack. Yeah. And that's what happens when you constantly pour and not refill. Because if you pour, at some point we're going to need to refill, because what are we going to drink? What, air? And I kind of like use those analogies for people to kind of understand, like, it's necessary at times to be selfish. It's necessary sometimes to disconnect from everyone. I mean, I'm selfish a lot. I never was. But guess what? I started feeling that void. I started becoming very overwhelmed. I became somewhat angry, resentful towards people, because I was like, man, I'm always giving. I'm always there. Who's going to be there for me? Who's going to give me?
What if you're dealing with people that don't understand that? Like, how do you, what's the right question? How do you still show them that you love them, you care for them, and have them? They might not understand it. It don't even matter at this point.
Exactly.
Because you got to make sure you do it for you.
You're doing it for you. I have to say, a lot of the times, so for me, I feel like sometimes it's not for people to understand, because I'm not doing it for them. It's for me to understand. You understand? Now, with all that being said, I do encourage people that if you have families, if you have people that you're really close to, just to talk to them about how you're feeling, just to let them know, hey, I've been overwhelmed. I just feel like, I've been overextending myself, and I really just need to like take a break. I need to like pour back into myself. I need to replenish myself. So if I'm not calling as often, or if I'm not checking in as often, it has nothing to do with you, but it's a me thing. Right now, I'm just working on me. So just please understand I'm just taking some time to just refill my cup.
Mm-hmm.
And if you kind of take the time out respectfully to kind of inform somebody of that, and they don't respect it, then I know I mean, for me, it's kind of like, if I've given you that much courtesy, it's because I care.
Mm-hmm.
It's because there's some love for you in my heart. And if you can't respect that, then for me, it's like you don't necessarily care for me. So you put me in a position to kind of just choose me.
Mm-hmm.
And sometimes that's just what you have to do. And believe it or not, those people who truly love you will come around.
Mm-hmm.
And if they don't, then their time is up. They just weren't meant to take that journey with you.
I agree.
You know?
I agree. I see on Instagram that you have this. I think it's a product you have to lose weight. Is it? Is
Oh,
that what it is?
yes.
Let's talk
So
about
yeah.
that.
So a lot of people say, well, don't you do mental health? But like, how did you get into weight loss and all that stuff? And I said, it's all relative, because a lot of the medications that I prescribe cause weight gain. A lot of the services, so like when I say integrative psychiatric mental health wellness center, is because I offer other services besides mental health. So IV hydration, sexual wellness, hormone replacement therapy, and weight loss. So a lot of those services that I provide are services that can counteract the side effects that the medications cause. So some antidepressants will cause like a low libido, low sex drive. Sometimes people are depressed because their hormones are imbalanced. A lot of the times, people like that work a lot, they have like foggy brain, or deal with some of the medications cause weight gain. Depression can cause weight gain. Depression can cause, anxiety. Anxiety can cause weight gain, like, because people stress can cause weight gain. So, I myself struggled with weight for a long time. So before I started offering the service, I actually, you know, took the medication myself, because I do medication assisted weight loss. And when I posted my before and after pictures, I kind of like went on a hiatus from posting on social media. And then I came back and everybody was like, who is that? You just posted someone. Who is that? I was like, that's me. They were like, absolutely not. That is not you. That is not you. And it's like everybody, I mean, my inbox is on fire. So, one of the things is, as a working individual, especially us as women, we take on so much. It's so hard just being a woman. People just don't realize we take on so much. And just with the stress alone, a lot of the times women don't have time to go to the gym. They just don't. After you've worked all day, you have the kids to take care of, you have the husbands, the partners, whoever, right? The world. Then what? How much time do you have left for yourself? Very little. So what happens? You're constantly eating on the go. Even if you cook, sometimes you have to cook the quickest thing or the fastest thing, because you don't have time to make those 5-course meals that you would want to provide your family with. I'm talking for the average working woman, right? So if there's an easy way for you to lose weight and still maintain your sexy and still look fly, then why not? So that's why, I'm very passionate about my weight loss program, because it's a weekly injection. It's FDA approved weight loss medication. I just released the weight loss journal. I'm sure you saw that. And the thing is, why I did the weight loss journal was because, like, I had clients that were losing weight, but when I see them on a weekly basis, I'm like, so what did you eat last week? How are you? Like, how was your week? What struggles did you have? And they're like, I don't usually remember. So I created that weight loss journal as an accountability tool. So now you have the ability to track your progress, the doses of medication that you're on, the weight, if you gained, if you lost, what struggles you had throughout the week. If it was this week you struggled with sweets, or this week you struggled because you were binge eating, like, that helps me to help you. So when you have that accountability tool, what I do is I have them bring it to the appointments. Every time I see them, let's review what happens. And it's also something that they can do, that they can use to, like, jog their memory. But it's a great tool. It's a great medication. A lot of people are on it. Once Oprah promoted it, that was it. Like, Oprah mentioned it, and that was just it. Everybody was like, I need that drug. I need that medication.
Oh,
yeah, that's, yeah,
I heard about
yeah. So the brand name is Ozempic. I mean, that's the one of the most popular, semaglutide. But they have so much. It's a peptide, but there's so many different other medications too that that help with weight loss. And I tell people it's an investment. Even with mental health, some people won't spend $200, $300, $400 on coming in for a visit. because they see it as a major expense, but they'll spend $1,000 for a wig. Priorities, right? And you have to think about it. It's just like, how important is your mental health to you? How important is your mental stability to you? You know, yeah, you look beautiful. Yeah, that makeup is nice. Yeah, the hair is on fleek. Yeah, all of that. But if you're empty on the inside, if you're battling, if after you take off all the makeup, the wig, the hair, and everything, and you look in the mirror and you see nothing, you're crying to yourself to sleep every night. What good is that? You know, investing into yourself is one of the best investments you'll ever make because the return is going to be so much more greater. Imagine if you invested, let's just say over time, in a year, if you invested $10,000 on mental health services, let's just say, just hypothetically speaking, let's say you invested 10 grand. When you think about $10,000 in a year, that's less than $1,000 a month, right? As a hairdresser, as well as you, a beautician, and you being in the beauty industry, how much would you say on average a woman spends while sitting in your chair?
About 200-300.
200-300.
But they gotta buy the wig and we gotta do the install.
Okay, so 200-300.
Could run up more.
More, right? So on average, let's say $250.
Yeah.
How often is that $250 person coming?
Probably every 2 to 3 weeks.
2 to 3 weeks. Okay. So 2 to 3 weeks. So about $500 a month. Let's say, right? So 5 times 12. So they're spending about what? $6,000 annually on hair. That's not including makeup. It's not including the lashes. That's not including anything else, right? So when you think about it, I mean, after a while, I mean, the hair at some point is going to end up in the garbage in a corner somewhere, right? So when you think about what return are you really getting on that investment, the $6,000? Not much. And look, I spend money on my hair, so I'm not knocking anybody that spends money. That's not what I'm saying. But you have to treat certain things about your life just as important as you treat your hair. You know, when you think about, it has to. When people come to me, for example, for weight loss, and they say, well, what are the fees for the services and how much do you charge and whatever, and I refer to it as an investment. And I ask them, I turn around, and they're like, oh my gosh, like really, it costs that much? You know, it's a few $100s. And I said, let me ask you a question. Do you go to Starbucks? Yeah. How often? How much do you spend monthly on Starbucks? And there's dead silence. Oftentimes I'm met with dead silence. I'm like, you probably spend more on Starbucks than you probably would have spent with me for something that's going to improve your overall health. Because let me tell you something, honestly, when I lost those 40 pounds, I have to tell you, when I walk into a room, I walk very different.
Yeah.
The slimmer me and the more healthy me, honey. Listen, the confidence is through the roof, girl. Yeah. I mean, when I was heavier, yeah, I was confident, but let me just be real. I wasn't as confident. I just have to say it. I didn't like the weight. I didn't like how I felt. I felt sluggish. I was tired all the time. You know, I had to position myself in a way to look slimmer in pictures. I had to figure out, let me see, like, girl, what's the app for me to slim down or whatever? I couldn't figure it out because I didn't like it personally. Listen, I don't knock anybody for their weight. If you're happy in it, rock it, girl. Wear it. If you want to be 300 and you love it,
but that's even healthy, though.
It's not. But if that's your choice, and if you sleep good at night, you know, because I'm all about personal choice. I don't push anything on anyone because I feel that ultimately, because if you push things on people, then you meet resistance. When you think about it, growing up as a kid, when your parents say, don't do, what did you do? You did it.
Yeah.
Because you went against the grain. So a lot of the times I want people to come to me willingly. I don't want to force sell you anything. I don't want to force you to do one thing, not even mental health. Because it has to be free will. You have to come in because you have to come in with that mindset. You have to come in ready for it. Because when you meet someone or a client who's ready for it, they're going to be in a position to receive. But when you have to force, I don't care what you say, what you do, you're going to constantly be met with resistance.
So what do you say to someone that's dealing with mental health?
Get help. Simple. Get help. And when I say get help, from a professional. It doesn't, I always tell people this, and you know, Lily, I always say this, it doesn't have to be me. Anybody. I don't care who it is. Online, there's so many resources. There's even free resources. I always tell people, look, if you don't have health insurance and you don't have the budget, and you don't have the money, 211 has free resources for mental health services. All you have to dial is 211. You can get all types of free. There's a lot of nonprofit organizations that does like free mental health services, counseling. There's like the health department. There's so many different resources that provide free mental health services. Honestly, when you think about, I always use the same analogy. I said, if you go to the doctor and they said that you had cancer, immediately, what do? What can I do? That's what you ask. You don't even allow, a lot of people don't even allow the doctor to present them with an option. It's like, what can I do? Can we operate? Can we whatever? You're proactive. You want to fix it now. But when it comes to mental health, there's this shame. There's this denial. Girl, I'm not crazy. I don't want anybody to think I'm crazy. I don't want anybody to think that I'm not right. There's so much like, just like this negativity, especially in the minority communities when it comes to mental health. There's nothing to be ashamed about. If you're struggling, you're struggling. Because I'll tell you this, if you're depressed or you're dealing with anxiety or whatever it is, over time, the stress that you get from that can cause you to develop cancer, high blood pressure, diabetes. It can affect your physical health. Yeah. Because what happens? If you're either, let me talk about depression for a minute. What do people do when they're depressed? They either overeat or not eat. They either sleep too much or don't sleep. So if you're overeating, sleeping too much, what happens? You gain weight, right? A lot of the times you're eating junk. What happens? Heart issues, high cholesterol, clogged arteries, heart attack, aneurysms, stroke, diabetes. I go on and on and on about it. So when you start to put those things in perspective and you start to compare mental health to all of those other illnesses, because what is mental illness? A disease of the brain. Depression, a disease of the brain. Some people say, well, do I have to be on medication for the rest of my life? Possibly. It depends. Because there's so many different factors that causes one to be depressed. Genetics, your environment, family dynamics, your profession. For example, someone who's in the industry, I mean, you can relate because you work with individuals who are in the limelight, who are in the industry, right? Who are on TV. High stress job. So if you're constantly being criticized and talked about and all that, I would imagine those people's anxiety are probably through the roof. If you have made the decision that you're going to be in this industry for as long as you can be, chances are you're probably going to need to be on medication for the entirety of that time, unless you're somebody that's really spiritually grounded, unless you're somebody who has a prayer life, who is in tune with their emotions, who's emotionally intelligent, who knows how to disconnect from that stuff. If you don't have those tools, then you're probably going to need to be on some type of anti-anxiety medication or something to help balance you out so you're not like pulling your hair out.
I have a question. Well, it ties in. Do you think, like, when somebody lies so much, a pathological liar, is that like some kind of emotional, like, issue that they're dealing with? Is it a sickness?
It can be, yes. It can be like a mental illness. And then that could come from so many different things. Trauma. I'm going to take one thing, for example. Let's say a person who was molested as a child, right? Oftentimes, a person who was molested, usually they're molested by somebody that they know. It's usually a family friend, a family member, somebody that's in close proximity. That's a secret. The person grooms them to the point where they're told to keep it a secret. So keeping a secret, a lot of times, is where the lie starts. Right? So you were taught that from a very young age because you were violated. And now this person who a lot of the times is much older than you, violated you and told you to keep a secret, which they told you to lie.
Yeah.
Right? So a lot of the times people develop habits even from trauma. So when people lie a lot, and I mean, gosh, oh Lord, honestly, it's one of my pet peeves. It's one of my pet peeves. If I identify or if I'm friends or whatever it is with people who lie a lot, it's just one of my pet peeves. I just kind of I know right off the bat there's a reason for it, and oftentimes it is trauma related.
So how do you deal with a loved one, and how do you address them in a healthy way?
It depends.
Dealing with that.
It depends. Honestly speaking, someone who's like a pathological liar, someone who lies a lot, you address them, you're going to be met with defense. Um, the confrontation it's probably, the outcome is probably not going to be nice unless that person is in a position to accept and receive. That person has to be in a position where they identify it themselves, because when they lie, they know they lie. But some people lie so much that they start to believe the lie. And they get to a point where they can't really differentiate the truth and a lie, because all of them become one.
Wow.
No, it's the truth, because that the lie becomes their reality. So, confronting someone like that, it's a difficult thing. It's, you can try to, address it with love, depending, and just say, hey, I want to discuss something with you. It's not an attack. You make a disclaimer up front. It's not an attack. I'm not, trying to come for you. I'm not trying to pick on you. It's just a concern that I have. And I'm only coming to you because I love you and I care about you. But I noticed that there's several times that, you said stuff to me that wasn't factual. You try not to use the word lie, because the word lie sounds very harsh, right? So, what do you mean? Like, you said some things to me that was kind of like, that it wasn't necessarily true, and you've done it several times. I don't know if you're aware. And then 9 times I tell, well, what is it? What situation? You bring up a few examples, and if the person becomes irate, or they become just like, they start to become upset and more defensive, leave the conversation where it's at. There's no point in trying to prove yourself or prove them wrong or whatever it is. Just leave the conversation where it's at and allow them to be them. Sometimes you just have to allow someone to grow and develop at their own pace. And at that time, you have a decision to make. Do I move forward in this relationship, or do I now have to exit stage left and love you at a distance? It all depends. How does it affect you? That's what you have to ask. Does this person's lying affect you in a way that it causes you not to sleep good at night? If the answer is yes, then you have some decisions to make. If it really doesn't affect you at all, then it's just whatever. Allow that person to live in their lie. Because it's not our job. A lot of the times we take on we take on positions that's not necessarily ours. My first lady said something to me. She said, Dr. Tania, everybody is not your assignment.
That's so true.
And that stuck with me. Because being a mental health provider, sometimes people come to you and they just want to dump on you. And it's like, I'm not always wearing that hat. I wear that hat for certain hours of the day, and then I'm done. I disconnect. When I'm not seeing clients, I'm not seeing clients. I don't want to talk about mental health stuff with my friends and family. If the topic comes up and you're in distress, okay, if it means that I'm going to potentially save someone from hurting themselves, absolutely. Because that's the vow that I took. That's the oath that I took, is to help those who are in distress, who are suffering mentally. However, I know how to set boundaries too. I'm not going to overextend myself to, so it's just kind of one of those things where you kind of have to figure out what works for you ultimately.
This was such a great topic. Such a great topic. But we have a part in the show where we talk about, get your cup, pinkies up. What's trending?
Okay.
Have you seen Lizzo?
No, I heard.
You haven't seen
I haven't seen her. I heard she lost a lot of weight.
She
I need to
lost
make it my
so much
business.
weight, and she looks good.
So I guess Lizzo's no longer promoting the. I mean, for a long time she was promoting just living in your truth and living in that. I guess she realized that it's not unhealthy. I mean, it's not healthy,
It's not
actually, that it was
healthy.
unhealthy.
Yeah,
I'm happy for her.
yeah, I'm happy for her too.
She
Yeah.
has a brand, like it's for plus size underwear and stuff like that. So it's like now that your image has changed, does your business and your
I think she needs to just educate people.
Correct. I think, you know, the thing is, a lot of the times when these celebrities or people in a position of power, because I would consider her a woman who's in a position of power, because when you can influence millions and millions and millions at one time with a click of a button, you're in a position of power. I think it's very irresponsible when you promote that unhealthy lifestyle, because let's just be real, nobody's healthy at 300-400 pounds. Let's just be real.
It's not.
It's unrealistic to try to convince and try to convey a message that could potentially kill someone. Let's just come on. Like, seriously. We know all the complications that comes with obesity, and that's morbid obesity, because that's what she would, in a medical term, she would be considered a morbidly obese woman. So to promote that, I get it. The self-confidence and the self-love, I get that. The body positivity, I totally get that. Love yourself as is, but in the same token, improve. You can always be better. I'm going to love my body right now as is, but that doesn't negate from the fact that I want to improve. I want to do better. But I'm glad. I'm happy. I'm happy. I'm really happy. I hope that trend.
Like, wow.
Yeah, I hope her followers, I hope they kind of like jump on that bandwagon too, and do what, like, just like Tokyo. Remember how she, for a long time? Remember for a long time she didn't care, and she was acting like she was okay with it, but deep down inside she wasn't. She lost over 100-something pounds. You know, loving it.
Too.
Exactly. For a long time, Monique. Exactly. A lot of them, they do that. I think they do it as a coping mechanism, because it's like, okay, so many people are calling me fat. They're fat shaming me. So you know what? Hey, I'm going to turn this around on you. How about I love my fat self? How about I'm going to flaunt it and I'm going to throw it in your face? But deep down inside, you know the truth.
They hurting.
You know? But I'm excited. I need to make it my business to go and look up Lizzo. But my schedule's like so tight. Sometimes I totally disconnect from social media. I don't see things until like weeks later.
Good for you.
I do. I totally disconnect. I don't even watch TV.
When to turn it off.
Yeah, I don't even watch, honestly, I don't even watch TV, so I have no clue. Someone was just telling me, well, you know, there's a war and there's this, and I'm like, really? I had no clue. They're like, what? You don't know? I said, I have no clue. See, I depend on people like you to tell me. Somebody's going to tell me. I said, listen, if it's something that's really, really serious, somebody's going to tell me.
That's true.
You know, and I depend on everybody else.
Man, I had an amazing time.
I did too.
Oh my God, this was so good.
Yes,
and
it was.
Clap it up for Dr.
This was so good. We learned so much, and I thank you for coming.
Absolutely, anytime.
And, you know, you are always welcome to come back.
Absolutely.
You want.
Yes. Thank you so much. Thank you, y'all.
I'm obsessed with building bosses. 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 Giving up is not an option. I'm obsessed with building bosses.